Let's look at homeostatic imbalances. Some immunodeficiencies here. You can have an acquired immunodeficiency like HIV. This is a virus that you acquired. Congenital means that you have it at birth. So this is where you would have an immunodeficiency because white blood cells are not working, because antibodies are not working. This really has to go down to the DNA where you had a mutation or a change in DNA. So you're born with this deficiency in the immune system due to some mutation in the DNA that was passed on. Immunosuppression is when the immune system has a decreased response. You can have this from chemotherapy or disease. Remember that not all chemotherapy drugs, there's many different kinds that work in different ways, but one that you were introduced to in Bio32 is a chemotherapy drug that prevents microtubule formation. Well, microtubules are needed in mitosis. They start developing in prophase and they align the chromosomes on the metaphase plates for the cell to split in half for division. And so chemotherapy drugs can decrease cellular division. And remember, these white blood cells are going to be proliferating when they become activated. And so some chemotherapy drugs can actually inhibit that proliferation, which can suppress the immune system. Some diseases can suppress the immune system. You can actually intentionally suppress the immune system. These are called immunosuppressive therapy drugs. Remember corticosteroids, this is a type of glucocorticoid. You learned about this when you looked at the endocrine system for the adrenal glands. And one thing that glucocorticoids do is suppress the immune system. This is what we refer to as a stress hormone. Remember that sometimes we inject cort into people in a local area of tissue where they have inflammation causing pain as a pain management mechanism. Also, anti-proliferative drugs to stop cloning of white blood cells if you have an autoimmune disease. So an autoimmune disease is when your own white blood cells are attacking your healthy, normal cells because they register them as foreign when they're not foreign. If you want to stop your white blood cells from attacking your own tissue, then you might take an anti-proliferative drug to stop the proliferation of the B cells. All right. Autoimmune disease, this is when your own cells are attacking your own tissue. Multiple sclerosis is one that you learned about in Bio32. Myelin sheath is going to allow for the action potential that's traveling down an axon to skip from node of Ranvier to node of Ranvier. We call that saltatory conduction. It makes the action potential travel much faster down that myelinated axon. And if that myelin is eaten up and destroyed by your own white blood cells, well, then you're going to have a slower action potential down that axon of the neuron. Graves' disease, we've talked about before. This is when you have an overproduction of thyroid hormone because there's an antibody that fits the TSH receptor on the thyroid gland cells. In Bio32, you learned about osteoarthritis versus rheumatoid arthritis. Remember, osteoarthritis is just a wear and tear with age, whereas rheumatoid arthritis is an actual autoimmune disease where in the synovial joint here, you are producing damage on the articular cartilage here. And so you get bone spurs developing, bone on bone, very, very, very painful. Lupus is another one. This affects a lot of different systems throughout the whole body. Again, autoimmune disease where the white blood cells are attacking normal tissue in the body. Type 1 diabetes is thought to be an autoimmune disease. Type 2 is when your cells are not responding to insulin. This is not an autoimmune disease, but type 1 is when the pancreas is not producing insulin at all. And if these cells are not producing insulin, it's thought maybe they were attacked by the white blood cells. It maybe was an autoimmune disease when the fetus was in the womb developing and throughout young childhood where the white blood cells are attacking the insulin producing cells of the pancreas. And then glomerulonephritis, we haven't reached the urinary chapter yet, but a glomerulus is an area inside the kidney that allows for plasma to leak out of the capillary and become the filtrate. The filtrate travels through these tubes called the nephron to ultimately produce urine. Glomerulonephritis is an inflammation of the kidney where the white blood cells are attacking cells of the kidney. So your glomerular filtration rate or your kidney's ability to produce filtrate goes down. And that can be really detrimental to the body as waste products start to build up. So if damage is already done, there's no treatment to prevent it. It's already been done, right? But if damage is ongoing, then you can give immunosuppressive therapy where you try and reduce the white blood cells activity to try and prevent damage on these tissues. Now, you can have some hypersensitivities where your white blood cells are kind of making yourself miserable. Allergies are one of them. You can have histamine release. Remember, histamine is going to trigger water to leave the cells of the epithelium, which make them kind of shrink away from each other, which makes the capillary more leaky, more permeable. And so fluid can go out into the interstitial space, causing local edema, local swelling. You get an increase in mucus production. And so you just have a swollen nasal cavity here. And of course, you can take an antihistamine for that. If it's on the surface of the skin, you can take a corticoid cream. Again, glucocorticoids reducing the inflammatory response. That would be a topical cream that you can put on. Anaphylaxis is a more severe case where you're actually getting swelling. You can get swelling of the tongue and swelling of the airways to where now you can't breathe anymore. And treatment for this is an EpiPen. Epi stands for epinephrine. Remember, epinephrine, norepinephrine are catecholamines. They're going to make the heart rate go up. They're going to make the respiratory rate go up. Blood vessels in the heart are going to dilate. Blood vessels in the skeletal muscle dilate. Blood vessels to the skin and digestive organs vasoconstrict. But something else that's new, and again, we'll come back to this with the respiratory system, is that the bronchioles, the airways down to the lungs, with the epinephrine that's there, it causes them to dilate. More air getting to the lungs with epinephrine release. Epinephrine is going to help open up the airways if you're under anaphylaxis, where you have so much swelling that it's shrinking them and making air hard to pass through those airways.